Welcome to the 1435th day of continuous and uninterrupted Zoom session of IFPH. Let us have a silent prayer to start. Thank you and welcome back. Today we have with us Dr. ARPITA CHATTERJEE MD, PhD scholar, CCH, CCP, MHA, London, FM. HOD, Associate Professor, Department of Pathology, Parul University, Gujarat. Guest lecturer at prestigious MSU, Psychology Department, ITM, University Vadodara and Sigma University, Chief Physician, Healing Center, Gujarat. Founder of the NGO World Heal Society Foundation, has been awarded Face of the Year Woman 2023 for social work and homeopathy by Fox India Media. Speaker of Scientific Committee Asia Best Teacher Award 2021, have featured in numerous TV, newspaper articles and social media. And the topic is understanding the psychology of patients with general anxiety disorders and its homeopathic approach. We all know that the world is in a phase of anxiety. A lot of persons, including the film stars, the sports stars, and the common man, are affected with this anxiety. It's an important and contemporary important topic. On behalf of IFPH, I welcome Dr. Arpita. You can have the platform for next 45 minutes. It's over to you. Please proceed.
Namaste. I hope I'm audible to everyone. Am I audible, sir?
Yes, please proceed. Yeah.
Yes. Thank you so much, everyone at IFPH for inviting me again for the second session, an elaborate session on a general anxiety disorder. So this would be the part 2 of my session, which I had done earlier. So for that, I would be doing a PPT presentation as well. So if I get a permission from all of you, can I share my PPT, sir?
Yes, you can, please.
Yes, sir. Is it visible, sir?
Yes, started. Yes, good, please.
Yes, yes. So as you can see, this is the PPT. Is it visible to everybody?
No doubt, please proceed.
Yes, yes. So the topic as it is, as Sir had already said, it is understanding the psychology of patient with general anxiety disorder and its homeopathic approach. It's part 2 of the session. So as we are seeing with the different natural calamities which are going through right now because of the monsoon at present in different parts of the country. So exactly this is the scenario for which we have to be, being a homeopath, have to be ready for how to approach such people and how to make them become because these are certain things which are not in our hands. But the worrying aspect of these patients, the person who are suffering from general anxiety disorder, are so realistic to them that they find it difficult to come to a normal place or to be in a normal mode of thought and understanding. So in today's scenario, this becomes a very important uh, issue which needs to be dealt with homeopathy, and homeopathy can help tremendously. And because it's the second part of it, so I will just do a little revise of the part 1 so that the people who are joining for the first time in this session can understand what actually is general anxiety disorder. And then we will understand the temperamental aspect of it, a psychological analysis, a little bit of it, and then we will just jump into the homeopathic approach. So this would be the entire session all about. Now, before we go to this part of revising the part 1, we need to understand what is general anxiety disorder. Now, general anxiety disorder is a disorder in which there are 6 different, what you call, symptoms which are present in a person. The symptoms would include, the first part would be that there would be irritability. The patient would be very much irritable. Uh, First and the foremost thing, the irritability, the fatigue, the lack of concentration, then there would be loss of appetite, inability to sleep. All of this, these 5 symptoms, would be because of excessive, uncontrollable worrying and thoughts. The patient would be unable to have a control on his or her thoughts, and these thoughts would be continuously about things of the past or probably of the present or of the future, which would be haunting these people. And the thoughts would be so much intense that they will not be able to control it. As a result of this, it would result in irritability of the patient. The patient will be irritable.
Excuse me, doctor, I think the slides are not moving, please.
Yes, sir. Hello. Hello. Is it audible, sir?
Audible slides not moving.
Okay, okay. Yes, sir. I'll just move the slides.
Okay.
Yeah, yeah. In that particular scenario, what happens is that out of the 6 symptoms which we have seen, uh, of the 6, only 3, if 3 of them are present, uh, the person would be diagnosed as having general anxiety disorder. Now, to this I have already explained in part 1. So here I would be just telling you what the kind of tool which we can use. It is the general anxiety scale which can be used. Like I said, the 6 main important factors are excessive thoughts and worrying will be there, uncontrollable. This will be followed by unable to concentrate, lack of concentration. Because the person is unable to concentrate, there will be irritability of the patient. Because the patient is irritable and all, would be unable to eat properly or maybe eating in excess. There would be also sleeping disorder as a result of it. If any of these, out of these 6 symptoms, if any 3 are present, then we can label them as general anxiety disorder. Of which, if you are unable to understand how to do it, then you use this scale. This is a very beautiful scale which you can use, general anxiety disorder scale 7. It's a questionnaire which can be administered to the patient also, and you can do it by keeping on your, you can use it at your desk. You can ask the patient and get it ticked by you, or you can make the patient do it themselves. So in here, what we do is there are 7 questions which are being asked. Out of the 7 questions, the markings are given as 0, 1, 2, and 3. Now, how this is done? If suppose the question number 1 is feeling nervous, anxious, or on the edge, this is the first question. So out of this first question, we need to ask the patient, or the patient can read himself also. It's written, if the patient is not feeling any of these things, not at all, then the score would be 0. If it is for several days, then 1. If it is more than half the days, meaning like for example, if it's a 2 weeks time, it is written that this is to be administered if the person is having these problems for the last 2 weeks. So this is very important to remember. Last 2 weeks, if the patient is having this issue, we can administer them and we can ask them that, are you feeling nervous and anxious or on the edge? If the patient says no, 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 not at all, then 0. If he says several days in this last 15 days, then 1. If more than, like first in 15 days, 7 to 8 days, then 2. Nearly every day, then you have to mark it as 3. So this is how you have to give the marking. So there are 7 questions which are asked. But first is feeling nervous, anxious, on the edge. Second is not being able to stop or control worrying. Third is worrying too much about different things. Fourth, trouble relaxing. Fifth is being so restless that it is hard to sit still. Sixth is becoming easily annoyed or irritable. And the seventh one is feeling afraid as if something awful might happen. So out of the 7 questions, if the after once you have ticked all the 7 questions, or the patient have ticked all the 7 questions, now we just need to add them up. So it's just simple maths we have to do. Once you add them up, so what will happen? Out of 7 into 3, if the highest is 3, so 7 into 3 is 21. So out of 21, so this is how we will have the score. So if the cutoff has to be above 9, so a person who is suffering from this GAD would be the one who is having marks of 10 and above. All right. So 10 come under the moderate scale if the score is between 10 to 14. And if the score is above 15 to 21, it is the person is having severe problem. So if you are unable to understand whether how to deal, how to understand that this actually in general anxiety disorder, this is a very simple skill which you can administer yourself, or you can ask the patient to do. So once this is done, now we need to understand what happens in general anxiety disorder. Like I said, of all the 7, you can see the all the 6 symptoms which is being given, out of which only 3 should have to be present. This is the as per the DSM-5 classification. So they what is given? The person should have this problem since last 6 months. The problem should be there, And since last 2 weeks, the problem should be so intense that the person would be approaching a therapist or a doctor. And out of the 6, any 3 need to be present. And if it is a child, then out of the 6, if only 1 is present, it is to be considered as general anxiety disorder. But here we would be just concentrating on the adults because children are a different understanding altogether. Someday maybe we can talk about that. When we talk about general anxiety disorder, now this is one thing about which the psychologist or the psychiatrist say that it is because of some pathological disturbances also that happens in the brain because of less amount of serotonin and more amount of norepinephrine. So this is something you should keep in mind. Why I'm asking you, when we'll go forward, I will tell you why it is to be remembered. So remember one thing which I said. In general anxiety disorder, in the scientific context of today's modern science, they say that serotonin level in these people are less, but the levels of epinephrine are high. All right, so remember this. And these people have a temperamental disposition where they do 2 things. These general anxiety disorder. This is according to psychology, according to modern psychiatric DSM-5. So they say that there are 2 main important things in this people which you will find. One is there's behavioral inhibition, and second is there's harm avoidance. So 2 things: behavioral inhibition, and second is harm avoidance. So they would try to avoid. So they are trying to control the situation, but in doing so, they think so much that they don't actually do anything. They stay away from people, they stay away from the social events, they stay away from public speaking, etc. etc. And behavioral inhibition, again, these people are very withdrawn. They become very, cornered, or maybe they become too much loud. That could be also in certain cases, but these people mostly have fear and distress. So there will be 2 things which you see in these people: behavioral inhibition and harm avoidance. So remember that as well. So in general anxiety disorder, these are 2 things which we will see in our medicines as well, which were not actually, this terminology was not used during during Henneman's time. But in today's time, if you see, we can understand what actually behavioral inhibition is and what is harm avoidance as per today's and 200 years back terminology. The meaning is exactly the same, only the terminology is a little different. So here we will understand Meissen medicine and the dosage and the management of it. So as per Organon, there, if we say about this particular problem, general anxiety disorder, so Dr. Henneman has said in aphorism 225 that these are because of emotional causes. And if these causes remain, they can, if there's a maintaining cause, emotional maintaining cause for a long period of time, this could lead to a disease process in later. And this is one possibility, which is exactly true in recent times. So for these people, the first, because it's an emotional causes, the cause of this problem are emotional, psychic medicine should be given, meaning medicines like before going for therapy, we should give counseling and make behavioral changes of the patient, which is a must, along with medicines. As homeopaths, we need to understand one thing, that in today's time, if we want to survive, if we want to make our, not survive actually, it's about making our presence known. If we want our presence to be known, we need to make sure that whatever we are doing is in par with what is happening in today's recent development, so that we, because if you see in organon, it is already mentioned, if the person is suffering from any mental disorder, basically which is because of some emotional causes, it is, if you see, it is clearly written that we need to give psychical remedies. You can see I have written it in the PPT as well. So psychical remedies has to be given with proper diet and regimen. And very interestingly, I'll tell you, in conventional science today, they do recommend these things like yoga, meditation, some diet changes. I will tell you about that also elaborately when we go proceed further. So, and along with medicines, psychical remedies means counseling, therapy, behavioral therapy, cognitive therapies need to be given. And we as homeopaths need to incorporate these teachings of Dr. Henneman as well whenever we are dealing with such patient. And of course, the miasm, it's a psoric miasm. Very clearly, it's just understood because as it is the emotional cause, there's no physical disturbances. It is psychological issues which is causing the patient to have palpitation, fatigue, or irritability, insomnia, etc. So it is psoric in origin. Again, you can see how Dr. Henneman was far ahead in his vision, in his understanding of diseases. One thing I will tell you, the very important thing which I told earlier also, and this time also, I'll just make you all remember this. And I want everyone to just, whenever you're talking to anybody in conventional medicine, just tell them, talk to them in their terminology. It becomes easier for them also to understand. See, it's like, if I speak in Latin or Sanskrit, it will be very few people who will understand. So, but if I speak in a language which is understood by the masses, it will be easier for people to also accept it. So similarly, when we are talking about temperament, we have talked about the four temperament which was given by Hippocrates, which we still follow, and it is still relevant. There's no mistakes in that. So what we need to understand is that of the four temperament, what is the today in psychology? How do they incorporate this understanding?
Excuse me,
What?
doctor.
Yes, sir.
Are you sharing the screen or not? But the slides are not moving. That's why I asked.
Sir, I didn't get it.
Slides are not moving.
Slides are not moving. One second, sir.
Yes.
Is it moving right now?
No, no, no. The first slide is there, but the
Is it, sir? See, Maizen, can you see the Maizen?
no, no, no. It's only the first slide.
Only the first slide?
Yes, that is I already indicated to you.
Okay, okay. Just a minute, sir. Just a
Yes,
minute.
yes. Now the 10th one.
Yeah. Like, so right now, can you see, sir?
Yes,
Is
yes.
it
Good.
visible?
Okay, okay.
Okay, okay. Oh, okay. Sorry, sir. I was not able to. I can't see. That's why. All right. Is it visible, sir? Right now?
Yes, yes, yes.
So when we're talking about the temperament, now why I'm telling you about this, because in general as anxiety disorder, as per the medical science right now, psychology, they talk that these people have a personality which make them a personality trait. In other words, if I have to make you understand, as homeopath, I will tell there is a mental predisposition, what we talk about as temperamental disposition to a certain kind of way of thinking or perceiving things. Now, for that, they use the word personality traits. So, every person has certain traits according to which the person's way of looking at life, thinking, or perception would be little tinted by those, traits. All right. So, this is what is they talk about this personality trait. What we say is temperamental disposition. All right, nothing wrong. The same thing, only the it's about the connotation. All right, the words. So we need to understand that they were using in today's scenario what they talk, what they say about what is sanguineous temperament, what is chloric, what is melancholic, and what is phlegmatic. Now, as we understand sanguine temperament as a people who are very talkative, who love to be the attention, cheerful, are very fun loving, wants to be the center of attraction. These are sanguineous people. The chloric one are the ones who are like they are the doers. They're ambitious. They are like the boss kind of thing. They have this boss type of attitude. They are leaders. They are go-getters. They're achievers. They have this. They are very easily get angry as well as a result of that. They are goal oriented. Very strong drives and desires are there in these people. The other aspect is the phlegmatic ones who are very laid back, like they will sit around, they are like, okay, whatever is happening. They're very easy go lucky types, very adaptable and flexible, in short. The melancholic one are the ones who are thinkers. Like they think a lot. They are always, philosophical kind of people. And no, most of the time they want to be perfectionists. They have an idealistic way of thinking, and that's the reason why they are mostly on the negative. They are not very optimistic. They are a little pessimistic way. of thinking is there. So this is about the 4 characteristics. Now, what about the present scenario? Now, this is the 2 things I want to tell you about. So, whenever you're talking to anybody who doesn't understand what is sanguineous, chloric, phlegmatic, or melancholic, just tell them about DICS, DISC. Now, when they understand DISC, they will understand everything, because in DISC, it's just like what we talked about, only the words are different. So, when we are talking about the sanguineous are the DICS. Of that, I means the influential people, the influence. They are the ones who would like to influence people because they love the attention of the people, because they want acceptance from people around. They are outgoing, they are lively, they are high spirited or charismatic, optimistic, all these things. Doesn't it sound like sanguineous? Yes, exactly. That is what I was telling you. So it's the sanguineous word can be used for influence. The D stands for dominance. Now, from that, I would ask all of you, just write whatever comes to your mind. What do you think it is? Chloric, phlegmatic, or melancholic? Just write it down in the chat box. What do you think? Dominants are the one who are result oriented, very firm, willed, forceful, and direct. They are. So, what do you think? What can be this? If you have written like if they are chloric ones, then your answer is right. Exactly, because again they are like that. They are very optimist. They are goal oriented, result oriented, direct, strong, want to achieve it. Forceful, strongly willed, right? Now, coming to 2. Now, I'll ask you again. So, it's just like a game. Take it like a game. So, I'll ask you, what do you think is C? C stands for conscientiousness. Now, conscientiousness means like they are very analytical, they are reserved, they are very precise, systematic. Now, what do you think would be? It is the melancholic or the phlegmatic? I think the answer is very easy. What do you think is some conscientious people? Are they phlegmatic or the melancholic? Because these people are analytic, reserved, precise, private, systematic. What do you think? Yes, of course, they are melancholic. So, what about S then? S stands for steadiness. They are very accommodating, humble, even tempered, flexible. Doesn't it sound like phlegmatic? Exactly. So, this is what it is. DISC, DICS, or you can say sanguineous, chlorotic, phlegmatic, or melancholic. So this is about the understanding of temperament as related to. Why did I talk about this? Is because when we will talk about homeopathic medicine, as we proceed further, we will talk about the homeopathic medicines. As we talk about homeopathic medicines, here we need to also understand the temperamental aspect of these medicines. I have just taken a few medicines because we have time constraint. Plus, homeopathy is vast, so it's very difficult to take everything at one shot. So I have just taken few medicines and I have done a little classification of it. I hope this would be easier for everyone to remember and to understand these few medicines. All right, so let's drive into it then. Okay, now these medicines, I hope everyone is able to see it. Is it visible to everyone? I hope it is. Okay, so here I have taken 3 medicines, and so these 3 medicines are uh, having a similar, theme. So the theme of these medicines: aconite, arsenic, alk, calcarea, kara. So when we are talking about general anxiety disorder, I have taken just a few medicines and will let you know so that you just remember when such patient comes to your clinic, you just get a clearer idea just by few symptoms, and you know this is the medicine. This is the remedy. All right. So aconite, arsenic, and calcarea. The theme is fear and anxiety. These themes are very prominent in these three medicines: aconite, arsenic, and calcarea. But in case of aconite, there is very strong fear of death, and it is impending, like as if it is going to happen. Very strong and intense. The fear is intense. Whereas in arsenic, there is this incurable disease. The fear of some incurable disease. They have some disease which is not curable, that cannot happen. Like they cannot get well out of that. See, I have just taken a few things just to make you understand. Even in arsenic, they have fear of death. But it is because they think that it's an incurable one. Whereas in the aconite, it's very much intense and it is more acute. Arsenic, it's not the acute thing. All right, little less acute. When it comes to calcarea carb, here there is a fear of breaking down, and this fear is from these people. Even if they are exerting a little physical or mental exertion, they think that they cannot do it anymore because they feel very weak. They become very uh, lethargic and they don't want to do anything more. And this fear of becoming physically ill because of overexertion or because of mental or physical work, that is the fear which is very predominant in calcareous carb. Now, one thing if you see the medicines like aconite, arsenic, and calcareous carb, I'll just make you one thing. Remember, calcareous carb, it is a very useful finding in modern science that people who are suffering from general anxiety disorder normally are seen to have deficiency of calcarea, meaning calcium. They have a little deficiency of calcium. They also have this vitamin B deficiency as well. And as I told you before, there is a connection which they have seen that it leads to lower serotonin levels. Serotonin are the ones which makes you feel happy. Now see, calcarea carb as a medicine also you can see that here there is fear of breaking down from physical illness and exertion. Even if you don't understand or if you think that homeopathy is not scientific enough, just understand why this particular medicine is so useful. And now today's modern science is saying that if calcium deficiency is there, it could lead to anxiety. See how beautiful this science is, right? So this is what I was talking about, the fear. The theme of fear is aconite is very strong fear of that there is impending and arsenic it is incurable, and here there is fear of breaking down from physical illness or exertion. The second is the anxiety. Now, when it comes to anxiety, aconite with the anxiety will be sudden, acute grief, cause of loss of memory, spell of rage, and hypersensitiveness. So there will be suddenness of this anxiety. Whereas in arsenic health, the anxiety will be more about the future, finance, and security. All right. Here in aconite is because of acute grief, loss, so that will lead to spell of anger and loss of memory, etc. But in case of arsenic, the anxiety is more related about the future. There's the apprehension, what will happen in future, what will happen about the money related to finance and security. All right. Whereas in Calcutta, we're just saying that because these people have anxiety to any kind of changes, they are the Calcutta people are the people who likes to be mundane work and they want to be in a routine kind of work. They do not like changes in anything. In a way, we can say that they are more over controlling. You can find them to be controlling ones. All right, and they have this. There's a fear of darkness and animals as well, but mostly the anxiety is related to the changes. They are not very flexible to the changes. That's a very important characteristic feature of calcarea anxiety. Now, what is the physical expression? When it comes to aconite, there will be more of shortness of breath, strong palpitation, and flushing of face because of the congestion, as we know in the aconite is very common. In arsenic, there will be restlessness. Although the patient will be very physically weak, but mental restlessness will be there, and the patient will be unable to, move around because of the restlessness, and insomnia will be. But in case of aconite, again there will be restlessness. Of course, that is there. But here it is because the acuteness, the sudden thing is so strong that it would be followed by the strong palpitation, flushing of face, shortness of breath. So it will be as if something has just happened. You know, that is that intense fear, anxiety you see in aconite. It's there. When it comes to calcarea carb, there will be more of palpitation, sweating, extremely fatigued. These people will be craving for sweets, chili, and laziness. Now, another thing I would like to tell here about the physical expression, why I have put it here, is because in general anxiety disorder, the physical aspects are not very prominent except for a few things like fatigue and soreness of muscles are there, but the cravings which we as homeopaths use, like we ask for what are your desire and cravings, it's very important for us to understand because these helps us to get the medicine. Now, what is the importance when it comes to in today's medical science? Is it really important? I'll tell you, yes, it is. Because it is seen that when you are suffering from certain deficiencies in your body will be craving for it. Now, if you see in general anxiety disorder, you can anybody of you can Google it out and see. If you just write what the food which are good for calming down anxiety. So one of the foods which you get are like chocolates. Chocolate is sweet, you know. So there would be this craving, and that's why you see in homeopathy we always give such importance to certain, craving, desire. These are the generalities which we take into consideration, which today's science is gradually trying to understand. So that's the beauty of this science. I'll tell you, more and more we go into the depth of it, we understand how beautifully we are equipped with this wonderful science of homeopathy. About the temperament, now it's very easy for all of you to know that aconite belongs to the sanguinis or the influenza. The arsenic is more of a conscientious or melancholic temperament, and calcula carb is phlegmatic or steadiness. So you need to remember the earlier terminology and today's terminology as well, and keep writing down the temperament of these people because of this remedies, because at the end I'll ask you which of the four temperament did you find more being aligned to general anxiety disorder, meaning of all the four temperaments, which of the temperament was found to be more having a disposition towards anxiety. So remember this question. Now for the prescription part, here I have made a very small understanding for all of you before doing any kind of repertorization or for understanding. If you don't remember anything, like if you don't want to understand also much of the things, just understand a few things of these remedies and you will be able to prescribe. This is my own understanding. I am trying to put it in front of you all so that as it is helping me out, maybe it can help somebody else out as well. So here, what I have done is these are the three medicines: aconite, arsenic, and calpiracar. So here we will just see three things. Just because if you see in aconite also there is fear, in arsenic also there is fear, anxiety is also there in aconite, arsenic, and calpiracar. What if you don't remember those things here? So what you need to remember is these. At least you need to remember these three things: causation, evolution, and expression. These three things are very important if you want to remember any remedy. So what is the causation for anxiety? Suppose if you're going for anxiety only, because this is a topic we are studying today, so we'll just go for anxiety. So if you're just studying anxiety, of all the three medicines, what is the causation of anxiety in aconite? What is the causation of anxiety in arsenic? What is the causation of anxiety in calpiracar? So according to you, whatever you understood in the first slide, if you can write it in the chat box, and if you see the things which are, if it matches here, then of course you have understood a little bit of it, or maybe I have been able to make you understand. So, as I told you before, in aconite, although there is fear, there is fright. Here it is because of shock, right? And terror stricken. It is written as pattern. Okay, causation is because of fear of shock and fright. Fright means intense, sudden fear. Remember that. Okay. In arsenic, the ailments are from despair of recovery. That is this mind affection, ailments from this financial loss, insecurity, and despair of recovery. This is very prominent in arsenic. So the anxiety is coming out of these three things: financial loss, insecurity, or that he will never get better. This is going to get worse only, or of death. In Calcaria, as I told you, they do not like changes. So there are insecure. There is insecurity about the changes. They are very. These people like to be. They are not very ambitious. They are okay with whatever they are having. They don't want to get too much money. They are, because they are reluctant to change. This is one thing which you need to understand in Calcaria, because they feel they are insecure about the changes. So that's very important thing in Calcaria. So causation here is because of the changes, insecurity, and bad news. Now evolution. If you see the disease evolution, how does the disease evolve? In aconite, it is suddenly evolve. Sudden, you know, just like that. There is some bad news and immediately the patient suffers. In arsenic, it is the later stage. So it's a little later on, gradually. There's a stress which is long standing for a longer period of time. Then in calcarea again, this is slow. Even if you remember the temperament, it is easier to correlate. You see, aconite is a sanguineous temperament. Of course, they will be more impressionable, right? Arsenic, melancholic. So of course, they are thinkers. They think a lot. So that's gradually take a toll on their body. Calcarea, phlegmatic. Of course, the evolution of the disease will be a little, very gradual. Expression. Now, in expression, you have to remember, in aconite, there will be anxiety, dry mouth, fast heart beating, and palpitation. In arsenic, mental restlessness, and the patient will be changing place continuously. All right. Whereas in calcarea, the laziness, extreme fatigue, palpitation, and they will be craving for sweets. So this is few things. Now that is how the anxiety would be expressed in these people. This is something I have told, but you can use the other generalities as well. This is just for your understanding and to remember a few points when you want to differentiate aconite, arsenic, and calcarea, because they have a similar theme, and the theme is fear and the theme of anxiety. All right. If you are using the repertory, if you see suddenness, aconite will get 3 plus. If you see arsenic, it will get mental restlessness 3 plus. And if you see calcarea, causation, bad news, it will get 3 plus 3 plus. If you are using Kent, all right. So I have used Kent. So I'm just giving a few examples to differentiate. That's it. All right. Now going to other medicines, the ones having the similar theme like gelsemium, lycopodium, silicea, and argenticum nitricum. Now these 4 medicines, gelsemium, lycopodium, silicea, argenticum nitricum, they have a similar theme, and the theme here is lack of confidence, all 3 of them. So what you will see is that these people, when they have to perform, there is a public appearance makes them feel nervous. That's a very common theme in all the 3 patients. I mean, all the 3 remedies. Secondly, there is timidness. Timidity is very much prominent, and they are also shy. Now let's understand what is in gelsemium. The gelsemium, the lack of confidence is because of inadequacy. Because they think they are not, they do not have adequate knowledge. They may fail in the exam, like the students have this thing. So the feeling of inadequacy, and this is so prominent in these people that even they might feel paralyzed by that fear of public appearance of appearing for an interview or an exams, etc. So there is the feeling of the lack of confidence is because of inadequacy. In lycopodium, these people they take responsibility. They like to take responsibility. But here, the fear of failure, the fear of failure is so prominent. Because of that, there is lack of confidence. And but the thing is that once the lycopodium takes on the task, takes on the stage, he will perform good. But before that, this patient will have this issue because there is a failure. This fear of failure is so prominent, and that comes out after taking responsibility. So because they have taken responsibility on them, so that becomes a very crucial thing for them, right? And these people have a tendency to cover it up by talking loudly or talking too much. Lycopodium will do that. All right. Now coming to silicea. Silicea will have lack of confidence. It will be a temporary loss, and there will be fear of public speaking. Now here there is very big difference. In silicea, the person doesn't want to face public. These people are very reserved people, and because they want to avoid. So that's a behavioral inhibition. If you remember, I told you before that in general anxiety, today's psychologists are talking about 2 things. One is behavioral thing and behavioral inhibition, and second one is harm avoidance. So if you see silicea have this behavioral inhibition, so the patient will try to avoid because doesn't like to be in public, doesn't want to talk, meet people. That's one particular thing of silicea. Argenticum nitricum, it is due to uncertainty. So they are not very certain about the situation, and they have this fear of heights and closed space and bridges and etc. So it is due to uncertainty of the events. So that's why there is lack of confidence. Now coming to the timidness or shy. So why the timidness or shy is because In Gelsemium, because of this timidness and shy, they will desire solitude and avoid public speaking or crowds, and there will be agoraphobic. In Lycopodium, the shyness or timidness is only in front of authoritative figure. If there is a subordinate, they will try to dominate those people. But in case of people whom they find that they are much better, higher level, he will be submissive, or he will be a little shy or timid in front of those people. Won't say much. Cilicia, they do not like to talk to people, do not like to get attention, they don't like to do much of an experiment. And in order to, avoid these things, they become workaholics. So they work a lot, and it is becoming workaholic is a way to avoid getting into social circle, meeting people, going out, or doing anything adventurous. So that's the reason why they're always involved with some work of their, or into their, into themselves, reading, writing, or anything like that. Argentinum nitricum will be having TB on the side, and that is the reason why they will be hurried. There will be this agitation and hurriedness. They will feel as if the time is very less. Although there would be time, they will do. There will be this, apprehension for to go to a church, or apprehension to go to some place. So much so that they will talk hurriedly. They will walk very fast, and that is because of that timidness only that is coming, and they will be shaky also at times. Okay, the expression will be here. Gelsemium will have extreme lethargy with drowsiness and tendency to faint. Now this is very different. Extreme lethargy with drowsiness and tendency to faint. Then lycopodium will have craving for sweet with GIT upset causing gas and blotting feeling. The same you see in argenticum nitricum also, but the difference here is that here, stomach belching and diarrhea. The patient will have diarrhea. So that's a different difference. And in glycopodium, there will be bloated sensation and craving for sweet, and the GIT will get upset because of the lack of confidence, or the timidness or fear of failure. And Cilicia will have difficulty in concentrating, and they will have fatigue, insomnia, all these things, headaches. So that will be the expression of Cilicia. Now, temperamental disposition, as you know, Gelsemium comes under the sanguineous. Lycopodium, as you see, is a very dominating people when it comes to the subordinate one. So they are Peleus, or the chloric one. The Cilicia people, again, they think a lot. They are thinkers. They like to be meticulous. They are systematic. Again, they go into that melancholic or conscientious people. Argenticum nitricum, and again, melancholic because of the constant. They have a little pessimistic thought of things. So that's why they are a little melancholic and conscientious. Now, when we are doing this analysis of these people, so how do we just again, as I said, gelsemium, lycopodium, silicia, argenticum nitricum. Just if you want to remember, just remember these three things: causation, evolution, and expression. So in gelsemium, what is the causation? It is from anticipation from inadequacy. So they have anxiety from anticipation and from inadequacy. Okay, remember, lycopodium, there is fear of failure after taking responsibility. Okay, Cilicia, the fear of public speaking and meeting, because they don't like people, they don't like to meet. In Argentinum nitricum, there are uncertainty about small space or heights. Alright. What is the evolution? If you see, the evolution in Chelsea, it is sudden and acute. Lycopodium, it is gradually. Cilicia, if you see, is a remote consequences of it. So something which has happened in the past, some time ago, maybe many years ago. So right now, if you try to find out the reason for this, you will not. Sometimes the patient will not remember also. So something of the past, or something remote which has happened, or some trauma or some past event, would lead to the evolution of sedation. Argentinum nitricum is again, it's because of again, there is a gradual development of the disease here, and it upsets the GIT. Expression. When it comes to the expression, gelsemium will be drowsiness but unable to sleep. Fear of pains would be there in gelsemium. So drowsiness with unable to sleep, fear of pains and autos. Although drowsiness but unable to sleep. Lycopodium, GIT issues will be seen. Celiacia, workaholic, this will be the defense mechanism of the person, and fear which will be unfounded. So if you go on asking the patient or knowing why it has come, why now the patient is having anxiety, there will be nothing certain which you will come at present. That will be something related to the past, somewhere remote past. In urgiticum nitricum, again, they will be craving for sugar and diarrhea. This is how the expression would be when they have to appear in front of public. But once they take the stage, everything is fine. If you see in repertory, how will you just see in Gelsemium, lycopodium, cilicia, all the three, the fright is 3 plus, intense fear. Again. But the difference in Gelsemium, the paralyzed from shock, it would be 3 plus. Lycopodium, there will be contradiction, which will be 3 plus. Company desire for 3 plus. On the other hand, in Cilicia, consolation 3 plus and timidity 3 plus, which you will not find in Gelsemium or Lycopodium. And in Argenticum nitricum, which you will not find in Gelsemium, Lycopodium, Cilicia, is hurriedness 3 plus and impulsiveness 3 plus, which will not be there in Gelsemium, Lycopodium, or Cilicia. So this will be easier for you to remember and also understand. Now, the last 4 medicines, Pulsatilla, Phosphorus, Natromune, and Ignatia. Now, in these 4 medicines, the theme is anxiety and they are moody. This whole 4 people are a little moody people. All right, so let's understand how the anxiety is there and why they are moody. Now, Pulsatilla, as you know, they are emotionally childlike. There's a childlike insecurity in Pulsatilla, which we will see the anxiety. In Phosphorus, there would be, these people are very social, they need approval from social circle, or from the romantic partner. They have intense and vivid fear, which are imaginative, and they're very open-hearted. So the anxiety comes from approval. Need of approval is the cause for anxiety here. In Natromune, some chronic stress or from loneliness or insecurity, which is for a long time, that would lead to this anxiety. And in Ignatia, there will be loss or recent grief. So this is the anxiety. Although all the 4 medicines are having anxiety, but again, in Pulsatilla, it's emotionally childlike insecurity would be there. In Phosphorus, there is need of social approval. Natromune, because of some chronic stress or loneliness or insecurity, there is anxiety. And in Ignatia, something which is just recent grief or losing someone very close, romantic partner, can lead to having anxiety. Now, moody. Now, what is the difference between Pulsatilla mood, Phosphorus mood, Natromune mood, and Ignatia? When it comes to Pulsatilla, they are very clingy. They are having weeping disposition, and they like to cling to, like how a child does. That's how they are moody. But in case of, and they will cry and they will like to be, cared for. Pulsatilla would like to be cared for, caressed, all those things they love. Whereas in Phosphorus, they are sympathetic and they have this overextending. So the mood is like they get moody, they become moody is because they are very sympathetic. They sympathize with people, they understand others' pain sometimes, or they overextend themselves when they are trying to get those approval, the good approval from people. So that's the reason why they become a little overextending, and it becomes moody. They become moody because of this excessive inclination to get approval from people, and by trying to be good with them. And although they are doing it for approval, so they are more of a superficial kind of intensities. They are not very deep. So their way of showing affection, care, or love, or hugging, although they need all of these things, phosphorus people, is very superficial. Whereas in Natromune, they're very deep. So when they make a connection, it is very deep, and it's very and these people make connection to 1 or 2 people, not many. They are so loyal and committed. These people. So these people are moody, and they want to be withdrawn. So they become very reserved when they are going through a stress or emotional mood swings. They want to be alone. They will cry alone, and they become withdrawn. Whereas Ignatia, the mood swings are very frequently changeable moods. So right now the person will be crying and suddenly the person will be bursting into laughter. And mostly these Ignatia people, because of the sudden grief, will have this depressed mood. Physically, if you see, the pubertal changes are the reason for pulsatilla, the hormonal changes, menopause, wants to be comforted, etc. In phosphorus, talking, conversation, rubbing on back makes them feel better, hugging, craves for cold, refreshing things. In natriumure, craves for salt and there are headache. And ignatia, alternating symptoms, anxiety with depression is very important. Now, as temperament, if you see, pulsatilla is more of phlegmatic. Phosphorus is sanguineous, natriumure is melancholic, and ignatia is again melancholic. So now when we are coming to the later part of it, so out of all the temperaments, so please kindly write down which is the temperament which is mostly dominantly having general anxiety disorder. Which of the four? Kindly write down in the meanwhile I'll let you know the causation, evolution, expression of pulsatilla, phosphorus, natrium, ignatia. So pulsatilla, the causation is hormonal changes most of the times. Phosphorus is overwhelming, some stimuli or sensitivity, overwhelming. Natriumure is isolation and dejection. Ignatia is sudden loss. If you see the evolution of this is in pulsatilla, this is the emotional childlike. Phosphorus is impressionable, rapid sensitivity is seen because they are very impressionable people, and they get affected by noise, by things around, even from exciting good news, all these things. Natriumure, they have this chronic stress that is the cause for the anxiety. In ignatia, it is sudden and acute. So this is the evolution, if you see. But in pulsatilla, the emotional maturity which should have taken place had not taken place. As if you try to understand that. Expression in pulsatilla, the mood swings, emotional weeping will be seen. Phosphorus will be this expression of this thing will be in case of very sympathy, type, very sympathy. They will sympathize with people, understand, hug them, harass them, take care of people, etc. Natriumure will be this person will want to be alone, want nobody. In ignatia, there will be contradictory symptoms which will be seen in ignatia. Crying, again laughing. So this will be two distinct things which will be seen in ignatia. If you see in repertory, pulsatilla will have changeable mood 3 plus, weeping 3 plus, but in that mildness will be only seen in pulsatilla. Whereas in phosphorus, sympathetic 3 plus, fear of loneliness and anxiety when alone 3 plus will be seen in phosphorus. Natriumure, here the patient will have silent grief, weeping cannot. So this is what natriumure is, weeping cannot. In front of people they cannot cry. Pulsatilla can cry. While telling you symptoms, also the patient will cry. Consolation aggravates in natriumure. Whereas in ignatia, there is changeable 3 plus, brooding 3 plus, and emotional hysteria. Now this is one thing, is 3 plus. So even if the now difference between natriumure and ignatia is that natriumure is having a issue which is from a long standing grief, but ignatia is a sudden one. Like for example, if there is a sudden loss of death, loss or loss of somebody in the family, the patient will be crying and in that grieving posture. That is what that ignatia patient will be. But natriumure, over a long period of time, if that grief, silent grief, will later on turn into that anxiety. So this is the easiest way of remembering and repertorizing pulsatilla, phosphorus, natriumure, and ignatia. I've tried to make it as simple as possible. And as I told you, so when you come to the rubrics, there are few rubrics I can just help you guide. Anxiety work inclination to, anxiety work manual after, anxiety health about, anxiety money matters, anxiety thoughts flying with, anxiety others for loved person, for anxiety chest. And so you can use such rubrics to get your medicines, but it depends how the case taking has been taken. Thorough case taking is a must to understand these things. And one thing, if you see the medicines have the which I have used or I have described, this phosphorus, calcarea carb, then we have natriumure. See, and calcarea carb, as I said, if it is less of calcarea carb, it causes less secretion of serotonin. The same has been found with phosphorus. If the body is having less amount of phosphorus, it can lead to anxiety. Again, if the body is having less or more of salt, it can lead to palpitation, anxiety. So if you see these remedies, some or the other ways have an effect on our mind as well. And that's why if you see the craving of these people are also, if in natriumure there's craving for salt. Now, we take, as homeopaths, we take these things into consideration. But many people will not understand. The laymen or any conventional medicine people would not understand why they are asking for these things. But if you see the science behind it, in anxiety, if you see, if you give a patient who is suffering from anxiety the magnesium supplements, if you give them supplements which have zinc, it works really well, you know, that helps them to calm down. So here are few of the things which have natural way of controlling, which you can suggest the patient, which you can also tell them, which will be easier for you even to make them understand at times. So if a person is having general
Yes,
anxiety disorder,
yes, Doctor, Dr. Arpita, we can have a third session of the same. Thus, the time is
so it's
just
already over.
okay.
So it's last sir. Yes, sir. Yeah, just last. So magnesium is one of the supplements which can be given, which helps to deal with stress and anxiety. Passion flower, it's one of the very good way, good medicine which can be used. Lavender as a smell, you know, smelling has been seen to correlate. See, we have this thing. If you see in phosphorus, there is this noise, sensitive to noise, sensitivity, hypersensitivity. So if you see even today, they ask people to use aromatherapy. Why are they asking people to do it when they are in anxiety? Because they know that it helps in giving relief. So these are the symptoms. Patient are themselves, entire materia medica repertory and organon. If you want to understand, if you understand your patient, that is how you can understand or homeopathy also. Just understand the patient, you will see organon in it, materia medica in it, natural holistic science in it, and also the conventional science in it. So everything, it depends on us. How do we look at the patient? How do we look at disease? How do we look at the surroundings? So make sure that as homeopaths we give holistic help to people around by giving them the right suggestion, advice, and therapy. Thank you so much. And if you have any query, you can just mail me or text me on my number, WhatsApp number. Thank you, sir. Thank you, everybody, for this wonderful session, which the platform actually. I felt very privileged. Thanks to Ganesh, sir. Thank you so much, sir.
So, yeah.
Thank you, Manoj, sir.
Thank you, Dr. Arpita. It's really a very good session indeed. And I hope this kind of presentations will definitely boost the knowledge of homeopathic doctors so that the remedy selection will be much better or easiest way if the doctors study the medical in this additional method also. Anyway, congratulations for your excellent session. Since the time is very short, I am not describing anything more. We have another session about to begin. I invited Dr. Bomley to say vote of thanks to the session.
Oh, thank you, Dr. Ganesh.
Thank you, sir.
On behalf of the IFPH, on this 1435th daily webinar, I would like to give my sincere appreciation to Dr. ARPITA Chatterjee for giving a very detailed differential repertory today. And her title was A Psychology of Patients and General Anxiety Disorder and its Homeopathic Approach. I think your approach is very, very good and very, very well expressed in this webinar, and it's given us our audience today the different choice of the remedy according to a different angle of view, and that is very good. Other than the mind repertory, we have also had to confirm the other symptom. Okay, uh, and thank you very much. I hope that you will come to share with us again, Dr. ARPITA Chatterjee. And once again, I will say a very big thank you to you on behalf of IPH. Over to you, Dr. Danesh.
Thank you, sir. Thank you so much, sir.
Thank you, Dr. Boglim, and thank you, Dr. Arpita Chatterjee, and those who participated in this session, and Dr. Manoj for moderating the first part of the session. And congratulations to all for joining the session. And I hope all of you will be back with us on the same tomorrow at the same time. We will have a session from Dr. Prakash Rao. The subject will be what is cure and what is curative, part 5. Thank you all.
Thank you.
Good night.
Good night, sir.
It's over to Dr. P. Shaila to moderate the Malayalam session.